break, although it's important to understand that it's not an extension of vacation. Everything still has to go on. We have to take care of our students, and I'll let Dr. Riddick speak to that as he needs to if he hasn't already spoken to that. But we wanted to make sure how we as a city, and we as a county, and we as a hospital are ready and able to do the things we need to do to go along with the school district when you realize that affects 30,000 people in our community. And although it may seem like something that people wanted to see happen, now it's our responsibility to make sure that we take care of everything that means for us as a community and as we react to what the school district does. So I think the entire hour and 10 minutes that we were in here, we addressed nothing but how we as a community come together with the school district and make sure we're doing everything they need us to do. We follow their lead to take care of our community.
Yeah, so it's just us coming together so that we can know from all facets of us as a community, how do we address the direct and indirect impact of what a school closure means, and how can we be tactical around addressing from our most vulnerable student to our most resource student. How do we approach what this looks like, as well as hearing from our health professionals, as well as hearing from the city and the county in regards to what that impact may mean for those individuals.
So what did y'all decide? How is the city going to support the district?
Yeah, so I will tell you that we've got a plan that we've laid out in regards to getting this first week done, and so that we can become very tactical around a number of areas, and we've outlined what those areas look like. So feeding is the first priority that we want to sustain and maintain. So our planning is designed to, at the early onset of this week, based on what we've done for the last week and a half, is come out with our timeline and implementation, and here's the plan. So we talked through on the city side what support that we may need in regards to distribution as well as volunteering. So if you go to our MISD website, there is a link for individuals who say that I'd like to volunteer, and where do you want to plug yourself in that regard. So it's about on the food, which we're going to tackle first. This is where we need that support and help. We talked about that there are individuals that are reaching out to the city that say we're ready and just share how and when and what we can do together. Or we may have some individuals that are ready to jump out there and get it started. But I would tell you that we will have a plan that comes out around what that could look like and where we will need the city's support in regards to what that planning may need for our student community of 26,000 plus.
What do you advise people to do to stay safe but not panic?
I think the most important thing is to be sure you're getting correct information. And Russell may want to talk a little bit about this, but making sure that the information you're getting online and at your favorite news source, understanding most of that's probably wrong. And the most important thing you have to realize is taking care of yourself, taking care of those around you, being clean, practicing good hygiene. Just because you sneeze or cough doesn't mean you have COVID-19. Also understanding, as we learned even today, there's 4 different COVIDs, and so the chances are you might just have a cold or the flu. We're not trying to minimize those things, but also realizing we can't be overwhelming doctors' offices and hospitals, and you need to call 68 nurse and get those answers before you panic because of the general panic that's going on around our nation. And I'll defer to Russell about some of those issues.
I think the first thing to know is there is not a confirmed COVID-19 case in Midland today. There is a lot of flu and seasonal illness, and they look very much alike, so that's important to understand. We've advised social distancing. You're hearing that term. It's a brand new term to most of us, but as we think about prevention, don't shake hands anymore. Try to keep your distance from people. Avoid large groups. We're particularly concerned about the elderly and those who are frail in their health, who have multiple system challenges, especially with their lungs and respiratory system. Those are folks who should probably stay out of crowds, stay home as much as possible, practice strong hygiene, wash your hands frequently and thoroughly. It's the basic public health things that we talk about frequently. We want to ramp those up in this time. But more than anything else, this is not a time to panic, not by any stretch. The disease is manageable. We certainly want to take care of our elderly and frail citizens as a first priority.
And that's where we're operating from the school side. So how can we help around with the city and with the hospital in some form or fashion in regards to how we're moving forward in regards to a closure? And I think you've got to weigh in a number of things, right? What you see on TV, when you walk into a grocery store, how do you maintain and sustain yourself through all the noise that's emitting itself to know that our community right now does not have a COVID-19 case? We have a school closure. How can we establish a routine within our community, and how can we support each other as we impact the community directly as a school system. It's very thoughtful. It's not driven out of a panic, because if it was panic, it would be total pandemonium and chaos that you would be seeing. It's very structured and very thought-provoking and very tactical on how we make our decisions that do impact a greater city.
So one of your questions about some steps, that's what's the most difficult part of this whole thing, because every step we put in place changes by some news we get. Even when we sat in this meeting, the CDC issued a new directive as far as the crowd size, literally within the hour and 15 minutes we were sitting in here. So everything is so fluid that we're dealing with, that you're trying to move and navigate and trying to determine whether you're dealing with a panic issue or you're dealing with something that's too much. And so things are changing very, very quickly, and even the things we discussed today, we'll probably have a lot of adjustments by the time we get to Wednesday or Thursday, as we're trying to take care of the most vulnerable and the ones that need the most. And again, that is our students, some of our most vulnerable students. That's why it's important when you're not panicking, you're looking out for your neighbor. You're looking out for your neighbor next to you who perhaps is elderly and vulnerable in their health as well. Just making sure as a community, rather than getting frightened about what's happening, we understand the reality of it and we start taking care of each other and paying attention to each other, because it's going to be stressful around here. People are going to get cabin fever. They're going to want to be running around and moving around, but this is not a time, because your kids are out of school, to send them to the mall. This is not a time for them to congregate at Starbucks. This is not a time for them to go to the movie theater and hang out. It's a reality. They need to probably stay home with you if they can and start reading and start working on their education and realizing this is not an extension of spring break. This is a cautionary note for our city and for our county as a whole.
And we talked earlier about establishing that routine. A routine is going to be very important for kiddos. The routine is not to wake up at 10 and go to sleep at 2 in the morning. The routine needs to be an established routine that has your health benefits built in. So what are you doing academically around literacy and numeracy? What are you doing around the fine art for visual and performing to keep your right brain plugged and tuned in? What are you doing around recess, around free time, around exercise, and around eating health? We're going to be addressing what that looks like on the eating health side, because that's going to be an important factor. But parents have to work to establish that routine. This is not the summer where it's a free-for-all and you do what you want to do. We need to make sure that parents are acknowledging there needs to be a routine built into the student life so that we can keep them plugged in and mitigate a number of other things that are going to be at the forefront of us. We don't know how long. Right now it's a 2-week window. We need to prepare for the long haul, but we certainly are doing it short term and then thinking through what it could look like long term.
Other questions?
Mayor, there was a bit of chaos last night at Sam's,
Yeah.
and it might have been stock related. What do you say to that?
Might have been what related?
Lack of stock. It might have been lack of supply related. We'll find out that tomorrow.
Yeah, from what we've heard from the police department, who is totally taking care of this situation, it was really born out of somebody who was unstable already and made possibly quite literally some racial innuendo. And so it turned into a tragedy. What we have to do, we don't know there was a stock issue or other things that are involved in it, but the FBI is involved. I think we have to sound a cautionary note as a community to realize that all of us are going to have to come together in this, regardless of what your opinions and fears might be, and know that we're not going to do that to one another. So, but the police department will continue to keep us up to date on that. I know it's been turned over to the FBI as well.
And I think the part of that is, not addressing this COVID-19 with fear, but taking our best interest from what our health profession is saying and how can we work as an entity to help mitigate what that could look like. We are not closing because of fear. I mean, we're closing because of a number of factors that are impacting what that decision is to run school on Monday and what mitigates that operational practice that makes it a deliverable that our community expects. So we got to think through what that means based on our adults who are not going to be present, our adults who are self-quarantining themselves. What does that look like so that we can make sure it's optimal for what our community expects for a delivery of academic learning? And so that's a challenge we had to confront and be very brutal with ourselves around, and then go from one decision to the next, which is going to be very fluid as we learn and gather more information and data. But if you stay on TV and if you walk in a grocery store, you have to release what that panic looks like for yourself. Our community is a great community and can stand front and have addressed a number of factors. This is just one of many that are going to come in the history of what Midland's going to have to confront. We don't want this one to be what we did in a way that took away how we have taken care of past issues and how we're going to address future issues based on this one aspect. We have to be ready in a good way on how we stay strong and help. Help your neighbor. If your neighbor can't get to the grocery store, if your neighbor can't get to a delivery of lunch, how do you help your neighbor make that happen? I asked my neighbor if she needed anything because we were going to the grocery store. I want to make that very important, that people take care of each other during this process, because that's what we should be doing and focusing a lot of our attention around.
Are you guys
Questions?
preparing as if it's a matter of if we see cases in our area or a when we see cases in our area?
If you're asking the hospital, and we'll start there, I don't think there's any question there that we will see cases in our area. We'll be very surprised if we don't. Testing is not yet widespread, may not ever be widespread. We've tested a very limited number of people in this country. For the vast majority of people, especially those who are not elderly or sick, this is a very minor disease. For many people, they never develop any symptoms at all. So it would not be at all surprising that there is disease present in the community already. We're behaving as if that's the case, and there's going to be more, and we need to be prepared for it.
You said that the CDC released a new guideline for crowd sizes. Is the city and county kind of looking at stopping some events, or what's your outreach with that?
Well, right now, we've seen most events already starting to begin to voluntarily say they're not going to have their event. We've made commitments as the city will reimburse fees and different things. We want to work with them on postponing. Most of them have been postponements. Say we want to plan on this a little later. We had an event coming up this weekend that they've postponed until July. So a lot of folks are beginning to realize it's going to be something we're not going to be able to pull off. And the county has some other challenges related to that, but hopefully the promoters and people involved in these events will realize it's not going to be in the best interest of their event to go ahead and have it.
And likewise, at the school district,